performance improvement nurse. She's performing audits on the client records, and she notes that a client's chart is missing documentation, and that documentation is on an advanced directive. All right, so immediately we have a kind of a picture of what's going on, and my mind is focusing now on advanced directives because that's what they're giving me. So I got to know, what is this about advanced directive, that I need to have a focus on that in my mind. The PI nurse, she's addressing the findings with the bedside nurse. So I'm just picturing that she's coming to her saying, hey, no one's documented on the patient's advanced directive. And this is something we do pretty much when a patient is admitted into the hospital. We will ask, do you have a living will or healthcare proxy, or some type of legal documentation that states what we should do for you in the event you're not able to tell us, or if you already have a standard that says this is the things I want medically done to me, in case I am unable to state that. All right, so our question, so that's pretty much our case event. She's auditing the chart, and she notices there's no documentation on an advanced directive. So our query is, out of these four statements, which statement by the bedside nurse indicates that further teaching on advanced directives is required? So we're looking for basically an incorrect statement. And that means that this is a negative query, and we're going to eliminate anything that is true. Eliminate true statements in this question, because anything true or that's an accurate statement made by the nurse means that she understands what's going on. But anything that she's saying incorrect, she needs further teaching. So further teaching is always a negative. So we're eliminating the true statements. So when you go through your options, you really want to focus on your process of elimination. Don't try to read through the question and just say, oh, that answer sounds right, and that's the answer I'm going to choose, because nothing else sounds right. Use your clinical reasoning why an answer is one to eliminate, or why is this not appropriate to choose? Does this fit the answer that I'm looking for to answer this question? All right, so some of you may already know what this answer could be, but we're going to clinical reason. With option A, should we keep that answer? Should we eliminate it? And you can say, or you can put it in the chat, or eliminate. Someone says eliminate. All right. Client denies having an advanced directive. Yes, eliminate. And the information will be charted shortly. So she's already addressed that this patient has an advanced directive, and I just got to go back in and chart it so that it will not be missing in the chart. So yeah, that's a good one to get rid of. All right, now we'll look at option B. Very good. Got several eliminate. All right, so option B, the client's spouse is the healthcare power of attorney and is bringing the legal documentation. What do we think about that? Option B. Good, get rid of that one. So she's addressed the document. She's addressed the healthcare power of attorney. She's already talked to the spouse and the client. Sorry, and the client said, "Oh, my husband has it, or my wife has the documentation. They're going to bring it in. They're my healthcare proxy, or they're my healthcare power of attorney, or DPOA. Sometimes you'll see it written as DPOA. All right, option C. The client is only being admitted for observation, so the information is necessary. Is that statement, keep it? Yeah, I agree. Someone said keep it. Keep that one. Very good. So the reasoning behind that needs further teaching. Yes, you definitely needs to be taught further. So the reasoning behind it is that even though they're in observation, that does not mean that we should avoid asking them about advanced directives. So that is a good one to keep. So now if we can eliminate D and we compare those two, because we're down to the final two, Everyone always gets to where they eliminate two and there's two options left, and I'm trying to figure out which one it is. Sometimes it's not that obvious, sometimes it is. So with D, the client requested more information and is currently considering their options. Is that a true statement, or is that an okay statement to address the advanced directive, or does that nurse need more teaching? Yeah, eliminate D. Very good. Awesome. So yeah, that's good. She's addressed that information. She's already taught to the patient, and the patient's like, well, I don't have an advanced directive, but I need some information about it. And that's what we do as a nurse. We ask the patient the information. Do you have an advanced directive? And it's our responsibility to offer that information to them. Very good. So that was our answer, C. All right. So as you go through that answer, if you were studying that and if you kind of forgot what advanced directives are, that would be your opportunity to go to your resource, look that information up, or use what information they're giving you in the rationale as part of your notes. Some of us like to write notes because we remember it easier. If you don't, reading it may be enough. Sometimes pictures help. With this one, you may not really have a good picture, but certain information you may need a picture to visualize what's going on. So it doesn't matter the length of time or the length of stay of the patient. Whenever they come in, whether they're being observed for so many hours, it is still good to address their advanced directive. Anything can change quickly. As we know, I work in ICU, so patients turn for the worse very quickly. So we need to address that when they first come in, when they're awake and alert and able to talk to us. Of course, in the real life, they like for us to chart in real time. So by the book, we should be charting as much to real time as we can. And she's saying we're going to get to it, we're going to chart it. So at least she's addressed it, and she's making sure that there's going to be a legal documentation placed on the chart. If a patient doesn't have that advanced directive, then we would address that and try to get them some information. All right, on Saunders, there is a small section on advanced directives and DNR. Just remember that a DNR is actually a prescription. So anytime a patient decides, I want to be a DNR, it's out of our scope of practice to put that in the chart. This has to be in an order, and the doctor has to go and talk to that patient, make sure they understand what they're signing. They have to actually sign a consent, informed consent for a DNR status. So a patient could be a DNR and decide to rescind their DNR and become a full code. And if that's the case, we have to be a patient advocate to inform that physician and let them know they want everything done. And even if they were a DNR, if they're able to still make their own decisions and they're with it, they have that right to change their mind.